Today, we are going to fill out a claims form example so that you can submit paperwork to your insurance company to potentially get reimbursed for out-of-network physical therapy services or other medical services. We are going to do an example Humana form because that's what my clients currently have, and I'll show you an example of a superbill, which is just a fancy term for a document that a physical therapist or other out-of-network medical provider can provide you so that the insurance company knows exactly what happened and what you paid cash for, and can then determine to see if those services are eligible to be reimbursed. Stay tuned. We're going to talk first about an example superbill. So it says a statement for insurance reimbursement, which is just a different term for superbill. A superbill is simply a receipt that a provider would give to you that you could then hand over to the insurance company. That just explains what services you paid for and what was done during those services and what dates they were done, things like that. On the left-hand side is going to be a bunch of information regarding the individual who received the service. So it's going to have two, and then it's going to have the primary insured's information there, including their address, client. This is going to be the kiddo if it is pediatric physical therapy, or the person who received any type of physical therapy services. The insured member is going to be the primary insured, as well as any insurance information if that has been provided. If not, it will likely be blank. Typically, that is up to the individual who is going to a cash-based service, whether they want to provide their insurance information. The provider who actually provided the service would be here. So in this case, I am the provider and I provided the physical therapy services, the provider's information. So the tax ID, the NPI number, and their license number. In this specific case, this kiddo had infantile idiopathic scoliosis. And so this is going to be the medical diagnosis. Typically for physical therapy services, you're going to have two different diagnoses, the medical diagnosis as well as a treatment-specific diagnosis that is more related to the musculoskeletal system, developmental delay, maybe a coordination code, muscle weakness. But the most important part is these letters and numbers right here. So these are the things that you're going to carry over on the form that we will fill out together. Stay tuned for that. Here you're going to have the date of service. If there's multiple codes per date of service, then you're going to have the date of service here. Usually this will either be the same date or blank date of service. You may have a kiddo who you evaluate and you do the evaluation, which is an untimed code, as well as treatment. And sometimes you'll have a evaluation that lasts the full 60 minutes. It really just depends on the case. For an evaluation in physical therapy, there's three different types of codes. So you have 97162 in this example, which is a moderate complexity. There's also a low complexity and a high complexity that have different numbers. You won't be responsible for that. Your provider will provide you with the code that they build. Then you'll have an explanation of the service as well as a number here. Now this 11 refers to the type of physical therapy that was provided, which is outpatient orthopedic physical therapy. It also is termed clinic physical therapy. Now, outpatient physical therapists can provide outpatient physical therapy in the home using a code number 11. In some cases with early intervention or a home health care agency for kiddos who are unable to go to a clinic to receive physical therapy services. In those specific cases, you'll see a 12. Again, your provider will provide you with the correct number. I did also want to go back to this service section, a service code, or also known as a CPT code. And so you might see those terminologies used interchangeably, service code or CPT code. Again, for the evaluation, since it's an untimed code, you could have it last for 15 minutes or you could have it last for 60 minutes and it's still just one code. The fee for me, evaluations as well as 60-minute treatment sessions are both going to be $120. For other providers, they may have different rates. So in this case, it is $120, and then it also shows that they are paid. Superbills may not have a paid column. If they do not have a paid column, you will need an additional statement or receipt that shows that you paid those services in order to get reimbursed. We'll talk a little bit about treatment codes. In this case, it is 97530. The difference with treatment codes in physical therapy is that one unit is for 15 minutes. So typically you will see 4 units per visit. Those units might not all be one. So in this case, it was just therapeutic activities that was provided for the full 60 minutes, different activities within therapeutic activities, but that was kind of the focus of that treatment. The GP stands for a physical therapist. Occupational therapists and speech pathologists will have different codes right there. It just tells the insurance company that a physical therapist provided this 97530 code. I'll show you next in a superbill where multiple codes were provided within that same 60 minutes. This is an example of a superbill where multiple codes were completed in the same day. For this example on 12/08, you can see that 97530 with the GP, which means a physical therapist provided that, was done for 3 units or 3 times 15, which would be about 45 minutes. And then 97140, which was like a manual therapy technique, was provided for 15 minutes. There's 3 units of therapeutic activities, 1 unit of manual therapy. Now, I personally charge the same amount regardless of code billed. So I charge $30 per unit or $120 per 60 minutes. Insurance companies have different rates that they honestly just kind of arbitrarily decide is what they will reimburse for. And each insurance company is going to be a little bit different. They all kind of base it off of Medicare, but they may reimburse slightly different for manual therapy versus therapeutic activities. If you see that like one date of service, you are reimbursed like slightly less, it could be just based on the code that were billed for that session. We have to be ethical and bill what actually transpired during that session. So just know that that's going to be a little bit different. And one thing that we didn't talk about is this make payments to section. The person's name is going to be listed here that the payments should go to. So typically it is the primary insured. So whoever is the primary insured, otherwise it will just be to whoever paid. Next, we are going to chat about how to fill that form out together. So get ready. Super excited. So this is just an example of a claims form, and that claims form is going to be different based on your insurance company. Some insurance companies don't even necessarily require a form. They just require you to electronically submit a statement that you paid as well as a superbill. It really depends on your insurance company. This specific insurance company requires a claims form, the statement, as well as the superbill, and then for those to be mailed in, then they process the claims, which typically takes about 20 to 60 days, and then they mail a check to the family. This is just what the form looks like. We will go through it. This employee/member name, that's going to be the primary insured. So this is usually a parent. It might be the dad if they have if there's a stay-at-home mom. It might be the mom if she's the breadwinner. It really just depends on the family. The home address of the employee. So it's going to be the address of the primary insured. So this is going to be the home address of the primary insured. So like this person's home address. Then you're going to have the patient's name. So this is the kiddo's name. Again, this is going to be the primary insured info. And then this is going to be the kid's date of birth. And then you would write like parent, guardian, etc. Make sure you have the group number in. Here's where it gets a little fun. This is where we went through everything from the last notes to kind of explain that. Now, some insurance companies are great. You could just be like, see attached documents. Now, I wouldn't necessarily recommend that, especially if it's the first time you're submitting the claims, because a lot of times they will scan this form in, but they won't scan in the attached documents. So sometimes things can get lost. You're going to want to carry over some of that other information, which is like the evaluation date, 11/22/21. And then because the services are provided on within a 24-hour basis, you can either put like a line or you can just write the same date here. The place of service, again, you're going to have these different codes down here. The 11 is the one you're typically going to want to go to. The doctor's office is really denoting the type of service. So this is going to be outpatient PT, where the patient home is going to be early intervention / a home health agency. 99% of the time is going to be this 11. Again, you can carry that over from the documentation that you'll receive from your provider. This is going to be like PT evaluation, and then you're going to want that CPT code / service description. On my forms, it says service, but the CPT code is 97162. Again, your evaluation code might be different. Again, there are 3 levels of evaluation codes for PT. That diagnosis code, again, for this individual would be M41.05, M62.81. And now I would just go like this personally because those don't change. You can choose to carry those over however you would like to. There's 1 unit, 120. Now, for example, if you had a service, say it's like 11/29/21 was the next service. Place of service is going to be 11, PT treatment, 97530, but you also had 97140, and you said you had 3 units of 97530. That's going to be 90. 1 unit of 97140, that's going to be 30. And then together, that's going to be 120. And so depending on what your physical therapist has, it might not be those exact numbers, but they should be able to provide you with documentation that breaks that down. So I use 2 lines there. So you're going to have 11/29/21 here as well. You can also write like see attached superbill. In this box, even though it says physician, you're really going to want to put like whatever your provider is. Maybe it's your doctor, maybe it's your physical therapist, maybe it's your occupational therapist. Dr. Lauren Baker, Dr. Lauren Baker in-home pediatric physical therapy. And then you're going to have the address. Since this is going on YouTube, we'll just put address. But again, you're going to want to put like the street name, the city, state, zip code in there. And then you're going to have the telephone number. This is really important because oftentimes insurance companies will call to verify that the person that sent the information in didn't just like make this stuff up. It's kind of a fraud protection. So you want to put in, and then also if there's an extension, you want to include that as well. The last thing is it says tax ID number. You want to put the EIN number, which is the tax ID number. So those are the same. It's going to be like a 2 dash and then a bunch of other numbers roughly there. It should be on the form that your physical therapist or other provider gives to you. But in addition to that, you also want to put the NPI number of the provider, because in my experience as being an out-of-network provider, you're absolutely going to want to have the NPI number. Whenever I call insurance companies, because I'm not in network with any insurance company, they will ask me for my EIN number, my tax ID number. I give it to them. They're never able to locate me. But if I give them my NPI number, they're like, oh, yeah, you are a PT. I would put the individual's NPI number in here as well. And then whenever you're calling insurance companies and they're trying to figure out information on the provider, I would always give them the NPI number because that's so easy to look up. If you don't ever have an NPI number, you can literally just Google NPI lookup, and then you can type in the provider's name and then location. And a lot of times that will come up. It's public knowledge. You can search me if you want. Everything will pop up right there. The next thing that you want to make sure you do is sign here and date. Now, this is the release of information. So this gives the insurance company the ability to call the provider or use your information in order to help you get reimbursed. What you do not want to do is sign this box, because this is the payment is going to be sent directly to the provider. Typically, the provider, if they're going to get paid from the insurance company, they are going to submit the claims themselves. If you have already paid somebody, you are done paying them. You need the money, right? And so you do not want the payment to be sent directly to the provider. You want the payment to be sent to you. You do not want to sign here. You can just leave it blank. A lot of times in an example form, if I fill out for my families like this, I will X that box out so they know that they don't have to sign it. But you do not want to sign there because you want the payment to go to you. That is the full example. You can take a screenshot of that information if you want to. Hopefully this was really helpful in allowing you to understand a little bit more of those nuances with submitting for reimbursement. The other things that I would really encourage you to do is always make copies before you send that information to the insurance companies, and then also have a folder that has the information. So it has the copies, and then also has a post-it note of when you mailed it. So you know when 20 to 60 days is. And I would always encourage everyone to call their insurance company around that 45-day mark, if not that 30-day mark, to make sure that they have everything they need. Unfortunately for us, it's really kind of in our hands that we have to do extra work for the insurance companies to reimburse us, because they're pretty stingy and they don't really like to pay if they don't have to, because they're for-profit organizations. So they make you jump through a ton of hoops in order to be able to get your money. But this is a program that you're eligible for if you have out-of-network benefits, and that is money in your pocket. And so you just want to be super organized, have the dates, and then a lot of times if they're missing something, it's like the provider's NPI number, because even though you gave it to them, someone didn't carry it forward, which happens all the time, guys. All the time. But it's just a quick phone call. Once you get to actually talk to a person, you can just verify that they have all the information they need. And you can also double check to see if the check has been mailed, because they will have record of that as well. If you have any questions at all about out-of-network benefits, cash-based physical therapy, creating super bills, or how I do it, and it's like automatically done through Simple Practice, which I can link to in the description if you're a therapist and you want to use that. It is a lifesaver. If you're a patient and or you're a parent and you are trying to go through this process and your form looks different, definitely make sure that you post those comments below. Again, anything you comment is public knowledge, but I will do absolutely everything in my power to help you find the resources that you're looking for to make this process as easy as possible so that you can get your kiddo the best care. And in my opinion, a lot of therapists who are solo practitioners and cash-based are just really good at their job. They're just frustrated with the insurance model, and they just want to provide really great care for kiddos. So anything I can do to make your lives easier, I am totally game with. Have a good day, guys. Bye.